Swadika and good afternoon. And today is Monday, the 19th of July 2021, and this is the English language summary of the press briefing from the Center of COVID-19 Situation Administration, or the CCSA. And allow me to remind you that we will be broadcasting live now 3 days a week, starting Monday, Wednesday, and Friday. I am following the briefing from Dr. Tawi Sin, who just now gave us a very grim picture and perspective on some scenarios, a simulation of future scenarios projecting the COVID situation in Thailand based on data until January 2021. And the worst case scenario that has been projected appears to have us resulting in a daily increase of infections of about 20,000 to 30,000 cases daily. If, however, we are able to control the situation with a high vaccination rate and with the cooperation of all sectors of society and also the public complying with public health measures and cooperating with us and working together with us, we hope that this worst-case scenario can be avoided. Now, let me turn to an update on the number of vaccines that have been administered since the start of our national vaccine drive back in February. We have, as of yesterday, the accumulated number of vaccinations now stands at over 4.3 million doses. And Thai health authorities are stepping up efforts to secure more vaccines to fight this latest outbreak. And therefore, the Ministry of Public Health will conclude a deal for 20 million doses of Pfizer vaccines very soon. And they are also preparing to secure an additional 50 million doses of Pfizer. The Thai government is committed to ensuring equal access to COVID-19 vaccines for all foreign nationals residing in Thailand, as well as the Thai public. And the Ministry of Foreign Affairs, in cooperation with the Ministry of Public Health, will be opening within this month an online platform for registration for expats wishing to be vaccinated. And the details of this particular platform will be announced in due course. And we hope that this will help our efforts in driving our vaccination campaign much more effectively. Allow me now to turn your attention to the reports of the new confirmed cases today, which we regretfully have to say stands now at 11,784 cases. We have active cases now standing at 122,097 cases. New recoveries have been reported today to stand at 5,741 cases, and this is a good number because it means that we have freed these beds for new incoming patients. We have a number of fatalities today reported at 81, and the accumulated number of fatalities stands today at 3,422. We today at the CCSA operational meeting had some observations of the developments going on. As we see now that the number of new cases in Bangkok has remained high, but it has been stable in the past week, while within several provinces, especially in the northeastern region, we have seen increased numbers of new infections. And therefore, the public is advised to exercise extreme caution and strictly observe preventive measures as well as personal hygiene, and mask wearing is absolutely recommended at all times. And also, the meeting talked about how we will now have 3 additional provinces added to the maximum control zone or the dark red zone. And these are Chonburi, Chachoengsao, and Ayutthaya. And so therefore, the maximum control zone now will add up to 13 provinces. And I will now then talk about the new measures that have been discussed since last Friday, and then later on, as I mentioned last Friday, they were being discussed in details by relevant authorities on Friday, and over the weekend, yesterday, the Royal Gazette published an announcement to update these preventive measures, and they will be effective as of tomorrow, 20th of July. And these measures will be in effect for at least 14 days or until the 2nd of August, when they will be reviewed again. Basically, the new measures are more stringent and targeted, and they are, as I mentioned, imposed only in the 13 provinces. And at the same time, the authorities will continue to closely monitor risk areas and conduct active case findings and testings, as well as vaccination of residents and arrangements for more field hospitals. So I'll explain how the new measures differ from the measures implemented last week. First of all, the number of dark red provinces, as I mentioned, has now been expanded to 13 provinces. And these are Bangkok, Nakhon Pathom, Nonthaburi, Narathivas, Pathum Thani, Pattani, Yala, Songkhla, Samut Prakan, and Samut Sakhon. These are the former 10 provinces where the measures have already been put in place. And the 3 newly added provinces include Chachoengsao, Chonburi, and Ayutthaya. Now, secondly, the public is advised to stay at home at all times. So this is more like a stay-at-home order. So the public is advised to stay at home and avoid making any unnecessary trips outside. Now, what does necessary constitute? Necessity means that you may leave the house if you need to make trips to purchase food items, basic necessities, medicine, you need to acquire medical supplies, or you need to follow up with your doctor's appointments, you need medical treatments, or you need to follow up with your vaccine appointments, or you need to perform job duties which are not possible to perform from at home. And there are also exceptions to those who need to provide necessary public health services such as transportation, post offices, banking, agriculture, transportation, public transportation for people, fuel, farming. So these exceptions will be made, and only for very necessary reasons. Also, very importantly, curfews are now in place for all 13 provinces, and the curfew I'm talking about is the curfew that was formally already implemented in the 10 provinces. So the curfew is from 2000 hours, or that's 8 o'clock in the evening, until 4 o'clock in the morning of the following day. Now, thirdly, I'm talking about new restrictions on inter-provincial traveling. So inter-provincial travel will be strictly restricted. And that means that should you need to travel across dark red zones for any essential reason, you will need to make a request to seek prior approval. Other than that, you should remain at home and strictly avoid traveling across the dark red zone. So if you are living in the dark red zone, or if you're outside the dark red zone and you wish to travel to the dark red zone, please reconsider. Also, public transportation will limit passengers to only 50% of normal maximum capacity, and therefore it will not be that convenient to travel across provinces. And also, yesterday, the Civil Aviation Authority of Thailand has announced that domestic flights to and from Bangkok and other high-risk provinces will be suspended starting from the 21st of July. That's Wednesday, this Wednesday. And exceptions are being made for medical flights, for emergency landing aircrafts, and flights in connection with the government's tourism reopening programs. And other domestic flights can only fly at 50% capacity. Fourthly, business hours for grocery shopping and convenience stores are the same. However, in shopping malls, they are now strictly closing all other shops that are not related to supermarkets and pharmacies and those selling medical and communications equipment. And also the exception is for those shopping malls who have assisted the government by providing vaccination venues. And all of these must be closed by 8 p.m., 8 o'clock in the evening. And also banks within the shopping malls are to be closed. Convenience stores and wet markets are still allowed to be open, but they must be closed from 8 p.m., so 8 o'clock in the evening, until 4 o'clock in the morning. Restaurants are strictly to be closed as well and at 8 p.m. and they are not allowed to provide in-dining services, so only takeaway will be allowed. And hotels must also refrain from hosting meetings, seminars, or catering events, but other than that, they are allowed to remain open. Both the private sector and government sector are encouraged to work from home 100% of the time or at maximum capacity. Exceptions can be made in accordance to necessity as well. Large gatherings are to be avoided of 5 persons and above. Unless absolutely necessary, you need to have any social functions, then these must be sought, prior approval must be sought before you organize any gatherings. So schools must remain closed except for online. So schools and online learning are encouraged, so must be in place. And all of these measures are blanket measures for all of the 13 provinces. However, each province can revise their disease control measures as appropriate, and the public is therefore advised to follow provincial specific measures as announced. So you must stay tuned to listen to what your province will announce, what specific measures are to be implemented within your province. So, I'd like to end my briefing today with a slide from the World Health Organization. And this is just a reminder for us to continue to stay in good mental health. No matter how daunting the situation may seem, but we all must come from this situation healthy and with a stable mental condition. So, in order to achieve this mental state, this healthy mental state, you should consider to exercise regularly, to eat healthy, to get adequate sleep, and of course limit your alcohol intake. And I'd like to remind everyone that we are all in this together, and if we continue to practice vigilance and remain strong, no matter how difficult the task is and no matter how daunting the environment and the situation may seem, we are in this together and we need your cooperation and your help in order to see us through and not to fall into the worst case scenario that Dr. Tawisin has just shown us earlier. And with that note, I bid you farewell. We will be back on Wednesday with Kun Natapanu. Thank you for your kind attention. ขอบคุณค่ะ สวัสดีค่ะ